Did all of my training in New Jersey, did my undergraduate degree in New Jersey, also went to medical school in New Jersey at New Jersey Medical School. From there went on to do a 5-year residency in general surgery. I'm also board certified in general surgery. From there went to the University of Rochester, Strong Memorial Hospital, and completed a residency in cardiovascular and thoracic surgery. Following that, I had returned to New Jersey and was doing strictly open heart surgery for about 4 years, and felt that that field was changing in such a way that we needed to look for some different avenues going forward. And initially it was sort of a gentle segue, continued to do open heart, and then became involved in veins, went for more training in the contemporary management of vein care. That was a big change from what we had learned back in our general surgical days. It was a big switch over from the open surgery with a lot of big incisions, blood loss, general anesthesia, hospitalization, to an in-office procedure which was minimally invasive. So that was a paradigm shift for us. I mean, it was a real education that we received in going out and getting some postgraduate courses. And that's going back almost 5 years now. We slowly started to develop a practice in varicose vein surgery and procedures, and have just continued the educational process to the point where we're doing veins in the center 6 days a week. Between my partner and myself, we continue to do some major thoracic and vascular surgery in the hospital setting, but we're rapidly moving toward full-time vein center work. We have the training. We have full-fledged cardiovascular surgical training. The physicians in our center are doubly board certified, as I said. And so we have a real knowledge of surgical technique, the anatomy, the physiology. We've done all of the biggest operations anyone could imagine. So I think we're equipped to deal with any emergency that occurs in the vein center environment. Although they're extremely uncommon, you are in the hands of those kinds of physicians who can handle anything that comes their way. But in addition to that, we've developed an environment which I think is very warm, puts people at ease, makes them feel very relaxed and comfortable from the moment they walk in the front door of our office. We also have a family sort of approach to what we do, literally and figuratively. We treat every patient like a family member, and we have family involved in the center taking care of patients at every level of their interaction with our center. And I think that that's something that we hear time and time again from patients, how comfortable they feel in the setting that we've created. It's very, very different than the hospital setting. Although we're doing cutting-edge clinical work, it doesn't have a clinical feel. It's not a sterile, cold kind of environment. There's a lot of warmth. From a technological point of view, I think we're cutting edge. We're using lasers for ablation of the saphenous vein. We're using lasers for the treatment of spider veins. We're using FDA-approved techniques and medications for the treatment of saphenous and spider veins. We have a full gamut of techniques that we offer the patients. It's a full armamentarium. There's no surgical procedure that we feel uncomfortable doing, and then there's no minimally invasive new procedure that we haven't kept ourselves abreast of. And I think it's one of the things that really sets us apart from many of the other centers in our area, which is a competitive market, so I think that's saying a lot. I want to thank you for taking the time to look for us here at bestveincare.com. We invite you to click onto our link, visit our website, and find out more about myself and the other physicians at our center. Hopefully we'll see you in the near future and can help you with your problem.